Evening, everyone. Welcome to Wednesday night. I've forgotten what date it is. It's the 15th of April. Time's just all merging into one. So this is part 2 of the Elbow OSCE that we've been doing this week. So thank you for those that have been taking part and giving me some information about some research that you've been doing, some really good things that have been coming through. I'm really getting the hang of these things now, so it's really good. If you haven't done one of these before, then welcome. My name is Mike, and hi, Catherine. And I'm the Education Director at Movement Therapy Education, and this is my clinic there. Nice and empty at the moment. So we've got, I'll just show you a little bit. Actually, if you've not been here before, we've got a gym all around the sides there. Hey, Peter. So a bit of a gym, couple of treatment rooms, and but we do a lot of exercise-based stuff here in the clinic. This is something that we've been putting together, and a couple of you have been joining us on the classes, which has been really cool. So we've put this together on our clinics page. So if you go to the Facebook clinics page, the link, that one there, if you want to take a picture of it, obviously you can. But if you want to go to the clinic page, hi Fiona, then we're doing in fact, Fiona's on this as well. So she's part of the Stronger Together group. And we are trying to help each other out, basically, by advertising our classes, our online classes across the country. Hi, Namir. How you doing, mate? If you want to have a look at what we do, take part in some of the classes, feel free. And that most of them are free. Some of them there is a small charge. Cool, great, Natalie, no problem. And have a look at those. If you fancy getting up at 6 a.m, those are the ones that I teach. So I'll see you in the morning. We're also doing a tendon talk as well, although this may change over the weeks because we'll run out of things to say about tendons eventually. So we're going to make it into a bit more of a clinic talk. So I think Dan and I next Monday at 8 o'clock are going to do a talk on clinical testing, I think. So we're going to have a bit of a chat with each other. So rather than me just going on, there's a bit of dialogue between the two of us. So if there's anything you want to cover, anything that this brings up as well that you want to go into a bit more detail, then let us know, and we can include it on our clinic chats on a Monday. I just wanted to show you this, just to put things in a bit of context. The next couple of slides will hopefully do that. I know I get quite a few people on these sessions that are mainly from a soft tissue background, and because the guys that have done all the kind of clinical work will think, oh, I don't need to do that kind of stuff. So, but actually, it's this has been a really good process for me going over these again. Because and I know some of my colleagues as well that have come on and or listened afterwards have said it's been a really good refresher for them, because there's a lot of things that they've forgotten as well. But I just wanted to show you these different levels here. So this is something called Bloom's taxonomy. I'm sure there are other models out there for learning, but these are the kind of stages that you go through depending on the level of your course. So if you've done a lower level course, usually you will be asked to define things, recall facts, and remember things about stuff. So you'll be asked a question, and it will be about memory recall. So that's the low level kind of learning, assimilating information. Then once you've remembered it, you then start to understand it, so you can describe things. Okay, and be able to describe it in a bit more detail, explain things to people, identify things. So, for example, with anatomy, be able to identify muscles and bones and ligaments, that kind of thing. Then when we get into the higher level courses, literally higher levels, so the level 2, level 3, level 4, so on, you then use the information, you execute it, implement it, solve problems with things, or demonstrate things. So the demonstration in what we do would be, okay, your task is to demonstrate a clinical assessment of a shoulder, and that would be applying your what you've remembered and what you've understood into a clinical process. Then when we start to get to this area here, this is where we are with this. Okay, so that this is going into the analyzing and evaluating stage. So we're trying to differentiate between information, organize that information in the sieve, compare it against findings, so signs and symptoms of one condition versus signs and symptoms of another one, to examine those things, to question things. Okay, so we're questioning the information that we're getting. And then the justification bit that I get you to do is the evaluation. So this is near the top of the tree of Bloom's taxonomy. We're approaching quite tough learning concepts. Okay, so you've got to be able to argue a position or defend your thoughts. You've got to be able to provide support evidence for the things that you've said. Okay, it's all very well just recalling something and duplicating it and go, oh, it's that, which is remembering things, but actually to justify it is a harder skill. Okay, so and that brings me on to this this next section here. So I don't really like the word incompetence. I think it could be better phrased, but this is often something that's used in teaching. Okay, so we kind of start off in this top left hand corner where you don't know what you don't know. Okay, you're unconsciously incompetent. You're unaware of the skill and your lack of proficiency. So, I've had a couple of people give me feedback going, bloody hell, I had no idea about this stuff. And that's entirely normal. Yeah, there's a diagram about it. Okay, so you're unconsciously incompetent. You don't know what you don't know. Yeah, and then someone makes you aware of what you don't know, and you then are in the yellow box. You are there. You know that you don't know stuff. Okay, so you then become consciously incompetent. You're aware of what you don't know, but you're not very proficient at it yet. Okay, so hopefully, it was my intention to make you consciously incompetent with some of these things, to make you realize that you didn't know what you didn't know, and now you know stuff that you didn't know. Okay, so that was always the intention of these, is to push people, because I know that this stuff isn't usually covered on the kind of soft tissue courses. So if you have felt like you don't know stuff, it's because I've done it deliberately. Okay, and it's really important for learning. Because I went through this. I went through this process where I was like, oh my God, I had no idea that might indicate that. I had no idea that there'd be these problems going on with the body. And, I've been quite happily just doing manual therapy work, and then realizing that there's a whole raft of things that I had no clue about. Okay, so you then become because someone's made you aware that you don't know it, you then go and research it, or you just carry on doing what you're doing. So it's up to you. But if you want to research things and find out about things, because someone has made you consciously incompetent, you will become a better therapist, or whatever it is that you're doing. Okay, so it's important to go through this process, and because this happens for me now, I don't know everything. I'm unconsciously incompetent, I'm sure, with lots of different things. And when I read papers and I read something that I'd never even heard of before, I then become consciously incompetent. I then know I don't know it, and I have to read about it, and I find out more. Okay, and then once you know it and you're able to use the skill, but with a bit of effort. Okay, so you still might have to look back at your books a little bit, or revisit some of the anatomy or whatever it is. You become consciously competent. So you know that you're okay, but you still know that you're not that great at some bits of it. So you need a bit of a refresher from time to time. And then once you've been doing it for a while, you then become unconsciously competent. So you don't even need to think about it. You just do it like automatically. So it's really important process to go through, and I know from some of the feedback I've had from people over the last 4 weeks that I know some of you have been somewhere along this pathway, and I think it's important to show you that you're not alone. Don't worry, and everybody's been there at some point, and that's the only way we can get better. Okay, so just wanted to share that with you before we go into this. Okay, so we've looked at a case history. I picked out some key points last time, and hopefully you start to create a sieve. Okay, so, and I know a few of you have emailed me, so thank you for that. So yeah, but second session, objective assessment planning. So I'm going to tweak things a little bit from what we've been doing over the last couple of weeks, just from learning what people have done. So yeah, elbow scenario, there's no right or wrong. Remember, you only hypothesis and you have to justify. So that's that top layer in that Bloom's taxonomy. Okay, you can't just recall facts. You have to be able to justify why you've said what you said and why it's not something else. Okay, and I think I mentioned that maybe last week, that this is a process about not proving you that you are right, but trying to prove yourself wrong. Okay, so if you think it's a certain thing and that's the only thing you test, it's called confirmation bias. And if you don't think about anything else or test any other things, that you may miss things. Okay, so if you think someone's got a rotator cuff issue and all you do is treat the rotator cuff, test the rotator cuff, do exercises for it, and you didn't do anything else, and you didn't think what else it could be that other thing, and you've missed it. And if you keep on doing the same things and it doesn't change, then yeah, it may take you down a different path. Okay, so yeah, no right or wrongs, just got to be able to justify it. And I'll show you how I've put together a sieve as well. So I've done that for you today. So first appointment, sifting through the sieve. That's what I've given you. Let me just share this again. If you've not seen it before, just shared that with you there, so that you can download that and start filling it in yourself if you want to. So these are the kind of things that I would put in my sieve. Okay, so I've got I've highlighted all the kind of key points. So we've got a 41-year-old woman. The reason why I've highlighted that is because there will be certain conditions that will be more prevalent in that age range and that gender. Okay, so that's why I've put that. Work secretary, I've underlined that. So have a think about what job does she do? What is she doing day in, day out? She's been doing it on and off since she left school. So that's been quite some time. And does that relate to the symptoms that she's getting now? Possibly, we don't know, but I'd highlight it. Okay. We've got a slight palsy or spasm on the left side of her face. Okay. And she hasn't noticed it. Drinks a lot of alcohol, and she's a heavy smoker. So I highlight those things. I'll show you what I do with that information in a second. Self-confessed terrible nutrition. You know, when someone says that their nutrition is bad, that it must be bad because they are confessing to it. Quite often people say, oh yeah, you eat okay, and then when you actually dig into it, it's not that great. But yeah, if someone's actually saying to you that it's not bad, then it must be pretty terrible. And the gait seems stiff. Okay, so we need to have a look at conditions where the gait might be stiff as they're walking. Okay, as well as musculoskeletal issues that may cause a stiff gait. All right, so that a bit of a clue there. Psychosocial things. So she's divorced. 2 of her kids who are grown up still live with her. She's very stressed and tensed and labile, so her mood changes quite quickly. So those are all things that I would include in my sieve as well. Hope you did too. Okay, so presenting complaint, she's got right-sided arm pain, mostly around the elbow region. And we had someone give some really good analysis just on Facebook Messenger this week. And they were saying, well, I can't think of anything that links the facial symptoms to the elbow. And it might be because it's not there. Okay, so don't worry about that. That's actually a good thinking process. So it's not always linked. there may be two things. Yeah. So just because, same with the lower extremity. So just because they've got a problem with their hip, it doesn't mean that it's having a knock-on effect with their ankle. They may be two separate things, and you might need to treat them very differently. So upper extremity weakness with intermittent paresthesia. Yeah, I've got that already ahead of you, Peter. So it's at the end of the slides, mate. I'll show you that when it's done. No problem. So upper extremity weakness with intermittent paresthesia in the right forearm and hand. Okay, so we talked about the blood supply and nerve supply to that region last week, and sorry, on Monday. So we have to have a think about that, and I'm going to give you some clues to. No problem, mate. I'm going to give you some clues to go and research for Friday. Okay, onset intermittent neurological symptoms for the last 6 months. So that's been going on for a while, but more specific elbow pain with the last 2 months after a busy period at work. So what could give you elbow pain working as a secretary if your workload is ramped up? Yeah, it could be something very simple with the elbow, or it could be linked with the other symptoms. Okay, it gets worse as the day progresses and then eases with rest. Okay, so aggravating factors for the elbow: using the PC, which obviously what she does for a living as a secretary, and using a screwdriver. Okay, so when she's doing that motion, then that makes her elbow worse as well. She's not fallen on it, you know, there's no traumatic injury. It's just after doing 2 weeks of ramped up work, it's started to aggravate her elbow. Okay, then we've got the next slide where things start to get a bit funny. Okay, so we've got suffers with periods of dizziness and vertigo. So you need to have a think, what kind of conditions make you dizzy? What things what things could be wrong with the body that makes you go dizzy, basically. Okay, and have vertigo symptoms, or maybe she has vertigo. All right, we don't know. She suffered from urinary urgency as well. Okay, so but that's been going on for a year. Yeah, we don't know whether she's had that investigated or not. Okay, so we don't have that information. So it's not a sudden change in bladder habits. And it's doesn't seem to be coinciding with any back pain or anything like that. So it could be a separate issue. Okay. This is an interesting one. So her father had a stroke. So what are the signs and symptoms of a stroke? Yeah. So if someone's coming into you with a kind of drop on one side of her face, symptoms down the arm, and then her dad's had a stroke, those are all pretty big alarm bells that are ringing. Okay, could it be a stroke potentially? So she's coming into you and she doesn't realize that she's actually had a stroke. So the test that you can do for that really quickly is the FAST test. So it's face, arm, speech, and then time. So you have a look at the face, which is obviously what is an issue with this lady, and you get them to smile. And if they can only smile on one side and the other side you can't, then we have a problem with the muscles in the face. Arms, so you get them to hold both arms up, and then you bring them up, and then you hold them there, and then you let go of the arms, and you see if they can hold them in position. And if one starts to drift, then that is a positive test for that. And then the speech test is to see whether they can speak properly. Okay, so you're having a conversation with this lady. If they have any one of those symptoms plus the family history of a stroke, you should be ringing 999. Okay, because that could be a stroke. All right, so just something to think about if you haven't thought of that already. So diet-wise, I've underlined vegan. Okay, so I want you to find out what symptom or what could a vegan diet be lacking in. Okay, so have a look at that, and then when you find that out, what kind of symptoms might you get if you lack that kind of thing? I don't want to give too much away. Okay, so what might you suffer from if you have a vegan diet. Okay, good. Well done, Peter. Really good. Yeah, so you might have a B12 deficiency. Yeah, really good. Well done, guys. So have a look at that, and then have a look at the symptoms of a B12 deficiency. Does it link in with our person here? Okay. So a couple of things to think about there. So neurological history. So we've got upper extremity weakness, paresthesia. Yeah, unilateral facial numbness and palsy. So we talked about that before. We've got a little note on there saying resembling trigeminal neuralgia. So again, that's something else to have a look at. Okay, what is trigeminal neuralgia and what kind of symptoms might they get? Really good, Bonnie. Thank you. Diplopia. So we've got double vision. What will give you double vision? Okay, why might she be getting that? And then we've got the dizziness and vertigo again. Okay, so we've got quite a few things there. And we need to order them. So this is what I did. So this is what I was talking about before, Peter. So I've put in the top there's kind of psychosocial things. She's divorced, nutrition intake, she's stressed, kids at home, labile, vegan, alcohol through the roof. Okay, so those are all the kind of psychosocial factors and lifestyle factors, if you like. And then try to separate out then the issues with the neurological symptoms and the elbow. So what muscles or tendons might be involved? So we've got bicep, tricep, flexor, extensor group, elbow joint, could be the humeral ulnar or radial ulnar joint, ligaments, the collateral ligaments and the annular ligament around the elbow. Yeah, fascial wise, there didn't seem to be anything fascial wise. Blood supply wise, because of the paresthesia, the father's had a stroke and the dizziness might be a blood pressure issue. Okay. And then nerve supply could be a facial palsy because of her gait, because of the weakness in the hand, the dizziness, the vertigo and the diplopia. Yeah. So we've got quite a few things there. And hopefully you'll see from what I've done here that it kind of leads you towards a condition. Yeah. So if you start stacking up all of the evidence from the sieve, then one column often gets filled more than anything else. And then you're thinking, right, okay, that it might be that. Okay. So, and again, if you've been trained in how to assess it, then you can. And if you're not sure, then you would refer. And that's what we do in this clinic here. Yeah. So the guys in here, we train them up on all this stuff. So, so the fitness guys, the S&C guys, the soft tissue guys will all go through our training program so that it helps them with things like this. And then if they pick anything up on their sieve, they can then come to us as clinicians and say, can you just have a look at this person, do this, this, and this, and then we'll go in. We'll do the test that they need to have done, and then we'll go, right, okay, you need to go there, or yep, they're fine to be treated. Yeah, so because of the team we work in, the decisions are made quite quickly. But if you work on your own, I understand that. It's you know, I've done that before. It's more difficult because then you have to send people away. But if you can form links in your local area with people that can do tests like this, then it will make your life a lot easier, and you can have discussions with them as well. Okay, about the symptoms that someone's having. And I completely get as well that you're sometimes worried about losing patients. So because if you send someone away, then they may never come back. So I mean that's happened to me before. It's just the way it is. You might lose a few before you find that good person that you can refer to, and then you create that relationship with. But that's just the nature of the game, unfortunately. So yeah, if you find good clinicians that want to work with you rather than try and nick your patients. Okay. So I've changed this into a bit of a task, really, rather than giving you the answers. So I've put in there a UMN lesion. So that is an upper motor neuron lesion. Okay. So what I want you to have a look at what that is. What does that mean? What kind of symptoms might they have? What kind of testing might you do? Okay. So we've got a nerve issue in the arm. Yeah. So which nerve might it be? at from the history. Possible neck issue. I know some of you have put that as well, which is good. Which level might it be at if there was a neck issue? Okay, what level would affect the areas of the arm that we're talking about? Musculoskeletal elbow. So what could be wrong with those muscles, bones, joints, tendons that has kicked off after she's been doing a load of work at her desk? Okay, working on the PC and doing lots of DIY by the sounds of it. That should be nutrition wise. What could it be? I think we've talked about that. Yeah, so with the vegan diet, a B12 deficiency, so that was really good. But so let's explore that a bit more. What kind of symptoms might you get with a B12 deficiency? Okay. And again, I mentioned this last week, is as soon as, because we get people to fill in what their dietary habits are, and if ever we have a vegan noted on the notes, and we've got in Birmingham especially, we've got a population that is a lot of Muslim from the Muslim community, and quite often they are vegans, vegetarians or vegans. So it's definitely something that we ask that population. Okay, but it's becoming more and more popular now as well. If someone's switched to being a vegan and they've not been used to it all their life, that might be one of the reasons why they're getting the symptoms that they are. I nearly said what symptoms they were then, so you guys have got to find those out. So this is a little job for you guys. So what to do now? So you got to put why, you got to do the justifications. You've got to research. Yes, yeah, perfect. Yeah, really good. Okay, so Catherine, but could the patient fill in the details and history on a digital document like Sports Injury Fix before they come in? Yes, that's exactly what we do. Okay, so all of these questions, we don't ask them on the first appointment, we ask them before they come in. Okay, because the last thing you want to do is go through that form and go, oh, I'm really sorry, but we can't treat you. So if we can safety net it before they come in, and we've got all of that information, and then if they do tick yes to anything, then we can give them a call before they come in to make sure that that they're okay. Okay, so that's really good. Really good by Bonnie there. Yeah, so B12, more bilateral full body issues than unilateral. Good. So that, again, this is part of the clinical reasoning process. Yeah. So if it's only on one side, is it a B12 issue? It's less likely. Okay. So when we're weighing things up and we're thinking, could it be this? Could it be that? What are the symptoms? If the symptoms don't match, it's less likely. We're not ruling it out completely, but it's the likelihood is lower. Okay, so that's really good. I want you to have a look at Guillain-Barré syndrome. Okay, so have a look at that, and we'll look at those on the session on Friday. All right, so you've got a few tasks to do. Okay, upper motor neuron lesions. Let's just go back. Yeah, so upper motor neuron lesions, the nerves in the arm that it could be, the level of the neck that it could be. But delve into that B12 deficiency stuff if you've not seen that before, and what condition could it be in the elbow. Okay, so a few jobs for you to do between now and Friday. I will see you on Friday at 6 o'clock as usual, and if you got any questions, post them in the Facebook group. Otherwise I will see you Friday at 6. Thanks everyone.